Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be going over childhood communicable diseases, but this is part 2. If you haven't watched part 1, make sure you go back and watch part 1, but you don't have to watch it in order. But I do encourage you to watch part 1 so you can have a more complete understanding on these childhood communicable diseases. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video, subscribing to this channel if you haven't done so already, and pressing that red notification bell so you'll be notified every single time a new video is released. Also, don't forget, I'm now offering next generation NCLEX reviews. I'm offering one-on-one tutoring / counseling what else do students ask for me for? Consulting sessions. So I'm also offering one-on-ones if that's something you're interested in. And also on my website, you can also look at all the audio lessons I have available. So be sure to check that out, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics, such as, well, variety of nursing topics, but on my platforms, you can find me on TikTok, Instagram, and Facebook. Okay, guys, let's get started. Childhood communicable diseases, part 2. Select all that applies. How can mumps be transmitted from one person to another? Select all that apply. Direct contact with infected persons, telephone calls, droplet spread with infected persons, visual observations. How is it spread from one person to another? Mumps. Okay, you guys did really good. So it's spread by direct contact with infected persons and also droplet spread with infected persons. Now, remember, you guys have to know the difference between, your droplet and your airborne. Remember, those droplets, they are very large droplets. They're 5 millimeters or greater. Then you have your airborne, which are very, very small droplets, or particles, I should say. So droplets are larger particles and your airborne are smaller particles. Very good. So no, you can't get it via telephone calls, and you can't get it by just visually looking at someone. You have to have direct contact with that infected person, or if they cough on you or sneeze on you and you go ahead and breathe in those particles, then you can be, I don't want to say contaminated, you can be infected. That's the word I'm looking for. True or false? The source of mumps is from the saliva of an infected person. Is that true or is that false? What do you guys see on the live? True. That's where the source is, from the saliva of an infected person. True. What is a classic symptom of mumps that is seen by the 3rd day of infection? Is it fever, headache, malaise, anorexia, earache, or enlarged parotid glands? Wow. Okay. So most of you guys chose fever, but the correct answer is enlarged parotid glands. And I want to show you guys something. This is how the test writers will trick you, right? Look at the question. The key word in this question is classic. Classic, as in when you see this symptom, your brain should be thinking of this. When you see this symptom, automatically in the back of your mind, you should be thinking of this disorder. You know how many disorders you see fever. Anytime the patient has an infection, they're going to have a fever. The term is classic, right? So fever, headache, malaise, anorexia, earache, you see all of these are possible in mumps. But a classic symptom, something that you'll see in mumps that you really won't see like in other disorders, too many other disorders, is that enlarged parotid gland. By the way, it could be unilateral, just on one side, or bilateral. But you see enlarged parotid glands, yeah, mumps needs to be one of those. I don't want to say differential diagnosis because I know you guys are doing PN and RN. If you are studying to be a nurse practitioner, that would be one of your differential diagnoses. But as a nurse, still something you on the list of diagnoses you should be suspecting, mumps should be one of them when it comes to the enlarged parotid glands. Okay, so that key word in the question was classic. And I just want you guys to see what that swelling of the parotid gland looks like. And again, guys, it could be one side or both sides. Look at this. And it's very painful. So just imagine the patient that has this. You think they're going to want to eat? So we're going to be concerned about nutrition. They're not going to want to eat. You think they're going to want to drink anything, swallow? We're going to be concerned about dehydration. On the list of everything else we're going to be concerned about just because of the other clinical manifestations that this patient will exhibit with the disease. Select all that applies. What therapeutic management is expected for a patient with mumps? Select all that applies. Do you expect them to get analgesics, antipyretics, IV fluids? Are we going to institute droplet precautions, contact precautions? Are we going to maintain isolation during the time of communicability? Are we going to encourage rest? What type of management do you expect that patient with mumps to have? You guys are doing great on the live. Keep going. Keep putting those answers in. Very good. All of them. I just went over not only the classic symptoms of mumps, but I went over the other symptoms that you would most likely expect to see that patient experiencing. So you should be thinking, okay, if I see these clinical manifestations, I'm looking at this enlarged parotid gland. I just heard Professor D say they're not going to want to eat. They're not going to want to drink. They're going to be at risk for dehydration. So yeah, I'm going to want to give them IV fluids, right? We saw that they can have fever, right? So we're going to want to give them antipyretics. I just told you, and I didn't even have to tell you, look at the picture. Look how swollen that gland is. It's painful. Yeah, they're going to need analgesics, right? Institute droplet precautions, of course, because we know we're putting that patient on droplet precautions. We know that these particles are very large particles, 5 millimeters or greater. We're going to put them on contact precautions because we know when it comes to mumps, it'll be spread by what? An infected person, direct contact with infected person. Yes, we're going to maintain that patient on isolation during the time of communicability. Why? We don't want anyone else to get infected. Yeah, they got to be in isolation. You better believe it. And of course, we're going to encourage rest because guess what? Your body needs energy to get better. Your body needs energy to fight infection. All of them. Very good, guys. Let's keep going. What is the period of communicability for mumps? Is it immediately before and after the earache? Is it immediately before and after fever? Is it immediately before and after headache? Or is it immediately before and after the parotid gland swelling? What is the period of communicability for mumps? You guys are quiet on the live. You don't know the answer? Take a guess. Very good. Most of you guys got it right. Remember that classic symptom, right? The swollen parotid glands. Well, guess what? That period of communicability, it's immediately before, immediately after that parotid gland swelling. Complex spots. These are associated with which disease? You see those white spots that you're looking, you can kind of see it on the tongue and the oral mucosa. Which disease are they associated with? Is it mumps? Is it measles, known as rubella? Is it pertussis, known as whooping cough? Or is it rubella, known as German measles? When you see complex spots, what disease should you be thinking about? Very good. Measles, rubeola, and you can't brush it off, right? So you have to teach the patient, because all they're going to do is harm themselves. When you see the Koplik spots, you need to be thinking of measles, rubeola. Select all that applies. What are the original signs and symptoms of measles, also known as rubeola, before the emergence of a rash? What signs and symptoms, what clinical manifestations are we going to see on that patient before we see the rash? Select all that applies. Fever, malaise, Koplik spots, cough, coryza, or conjunctivitis. This is select all that applies for the patient with measles, also known as rubeola. Excuse me, guys. Okay, all of them. You will see all of these before you see that rash. Patient will have a fever. They'll have a malaise, but just that general feeling where they just don't feel well at all. They don't even want to do anything because they feel so horrible. You'll see those Koplik spots. Patient will have a cough. Coryza, that's that inflammation you'll see of like the membranes, like basically rhinitis, that runny nose that you'll see with the patient. Okay, coryza, and then conjunctivitis. They'll have you may see the redness in the eye. It's going to be painful for them. It may be infected. Those are clinical manifestations you'll see before you even see that rash develop. When does a descending rash in measles, rubeola occur? So when it comes to measles, rubeola, that rash, it starts from the top down. It's descending. When does a descending rash in measles occur? Is it 1 to 2 days after original symptoms, 2 to 3 days after original symptoms, 3 to 4 days after original symptoms, or 4 to 5 days after original symptoms? You guys see that? 3 to 4 days after the original symptoms, that's when you start to see that descending rash. What's the treatment for measles rubeola? Is it antibiotics, antifungals, vitamin A, or vitamin C? Vitamin A. That's the treatment. For how long does a patient with measles, also known as rubeola, have to remain in isolation? Is it until the 3rd day of the rash, until the 4th day of the rash, until the 5th day of the rash, or until the 6th day of the rash? How long do they have to remain in isolation? Okay, guys, and correct answers until the 5th day of the rash. So the patient's in isolation for the time of communicability, the time that they can transmit to someone else. So until the 5th day of the rash. True or false? During the prodromal stage, rest and quiet activity should be encouraged. Is that true or is that false? It's true. So the prodromal stage, guys, that's just a fancy term just to describe the time between the point of infection or incubation and the clinical manifestation of those symptoms. So you've been infected, but you're not displaying any of those symptoms yet. So that time between infection and displaying the manifestation of those symptoms of the patient being symptomatic, that time frame, that's the prodromal stage. And guess what? During the prodromal stage, yes, they need rest. Yes, they need quiet activity, but it's important to remember that they are still infectious. True or false? Patients with measles, also known as rubeola, should be on airborne precautions. Is that true or is that false? True. They're going to be on airborne precautions. Very good. True or false? Pertussis is also known as whooping cough. Is that true or is that false? I think I actually gave you guys the answer in one of the other questions. Everyone should get this correct. It's true. Select all that applies. How can pertussis, also known as whooping cough, be transmitted? Select all that apply. Is it by direct contact, blood, droplet spread, indirect contact with contaminated items, telephone conversations? Professor D, I have no idea. I give up. What do you guys say? Select all that applies. How can pertussis, also known as whooping cough, be transmitted? Someone on the live just asked, why is the NCLEX never like this? Because on the Kahoots, I'm basically giving you guys just content, facts, and I explain it to you. But NCLEX expects you to already know the content and facts, and they want you to think critically through the content and facts, especially this new next generation NCLEX. They bombard you with unnecessary information to see if you can pick out what's important. So right now, I'm just giving you guys a foundation. Let's talk about this. So whooping cough, pertussis, how can it be transmitted? By direct contact with infected person? Yes. Not by blood. By droplet spread, they cough, they sneeze on you, and you breathe it in. Absolutely. By indirect contact with a contaminated item. So somebody who has pertussis and they cough on an item, or they get those particles on an item, and now that item's contaminated. Now you touch that item, then you put your hand in your mouth or your eyes or your nose. Now you've contaminated yourself, right? But not by telephone conversations and not by blood. True or false? Immunization is the best preventative measure for pertussis, also known as whooping cough. Is that true or is that false? Immunizations, also known as vaccinations, that's the best preventative measure for pertussis whooping cough. True or false? True, very good. And before I move on, let me tell you guys something about the next generation NCLEX. They are very big on preventative measures. And to be specific, primary preventative measures, right? What's primary prevention versus secondary versus tertiary? Well, when it comes to primary preventative measures, the patient doesn't have it yet. We want to prevent them from getting it. So we do lots of what? Education and immunizations. When it comes to primary prevention, education and immunization, the patient does not have it, and we want to prevent them from having it. Now, secondary prevention measures, that is when we suspect maybe the patient has it. So we're going to kind of do some tests, such as, doing a biopsy, doing a mammogram, doing a colonoscopy, testing to see if the patient has it. And if they do, how far advanced is it? Tertiary preventative measures, the patient already has it. We just want to keep it from getting worse. So examples like that would be physical therapy, occupational therapy, speech therapy. Okay, moving on. Select all that applies. What is the treatment for pertussis, also known as whooping cough? Is it macrolide antibiotics, fluids, humidified oxygen, suctioning as needed, maintaining standard and droplet precautions? And I forgot to add select all that apply on there, but this is definitely a select all that apply question. When treating a patient with whooping cough, also known as pertussis, what is expected treatment? I'm so proud of you guys. Look how well you did. Yes, all of them. You expect the patient to get macrolide antibiotics, okay? This bacterial, kill the bacteria. We expect to give them lots of fluids. We want to keep that patient hydrated. Humidified oxygen, because guess what? Oxygen is very drying. We're not trying to crack the nares, cause an opening for more bacteria to get into that patient's body. We're going to suction them as needed. We got to keep that airway clear, and we're going to maintain that patient on standard and droplet precautions. You guys did wonderful. Okay, guys, thank you so much for watching. Please, in the comment section, let me know what you thought about this Kahoot. Let me know what you'd like me to cover more or in depth. And don't forget, I'm offering next generation NCLEX reviews. I'm offering one-on-one tutoring / consulting sessions. And don't forget, I also have audio lessons available on my website. You can find it all at nexusnursinginstitute.com. Guys, thank you so much for watching. You guys catch me on the next video.